everyone. So today we are going to study about the chemotherapy of malignancy. Now, as we all are aware, malignancy is nothing but refers or is relative to the word cancer, and cancer is also known as neoplastic. So today we are going to study or focus more about the anti-neoplastic agents or the drug used in the therapy or the chemotherapy of cancer or to treat cancer, rather than discussing what is cancer, what is its history, what is its brief account. We are not going to just have it. We are going to study rather in brief account to the drugs. So what is cancer? As we all know, this is one of the most health challenges of our time. Is not a single disease, rather it is a group of disease, okay, that is characterized by uncontrolled growth and the spread of abnormal cells, which eventually leads to death. Now, as the human body is prone in cell division, so certain tumor cells or certain harmful cells undergo the process of breakdown and continuously continue to grow and divide uncontrollably, forming a mass which is called as tumor. Okay, and not all cancers form tumors. This is in the case of leukemia, right? And in other case, or now there is due to genetic mutations, environmental exposures, or due to certain lifestyle choices or any kind of immune responses, cancer has been growing from all the ages, right? From the newborn child to an old age, it has become a very commonly happening disease. Okay, now if not treated, as we all know, it can invade the surrounding tissues and organs and rapidly entirely invade your entire system and may lead to death. Okay, so as we all know, it is a major cause of death, and the treatment of cancer is still unsatisfactory. Still the entire proper treatment are not given, but other treatments like your the major treatment, that is your radiation therapy, or if there is only a mass, so the surgery or chemotherapy is given to the patient, and which for the capacity of the cancer cells for uncontrolled proliferation, invasiveness and metastasis is stopped with those chemotherapeutic agents. So which are those chemotherapeutic agents and what is its cycle? First let's understand. So we have the multiplication process of cancer cells. So we all know there is G1, that is pre-synthetic, S, that is synthesis of DNA, G2, that is post-synthetic, and mitosis phase happening. Mitosis is nothing but the cell division. Okay, and G1 is pre-synthetic phase and the duration is variable. During the S phase, the synthesis of DNA occurs here, and then after in the with the help of the replicating enzymes like your DNA and RNA polymerases, topoisomerases, thymidine kinases and dihydrofolate reductases are maximum at this phase, around 12 to 18 hours duration. And now G2 is the post-synthetic phase, that is 1 to 8 hours, and in the M phase it is mitosis occurs and the daughter cells may start dividing or may enter into the dormant phase, that is the GO phase. Okay, the knowledge of cell cycle may be used for staging and scheduling the treatment. So however, we have to understand this cell cycle in order to understand what is the treatment to be given, what is the stage of the cancer, and different stages of cell cycle can be understood, and henceforth the drugs and the treatment is provided to the patient. However, some drugs are cell cycle non-specific. Now cell cycle specific drugs are for S phase antimetabolites like antibiotics like your doxorubicin, epiphotophyllotoxins, Vinca alkaloids. G2 and M phases में we have bleomycin, M phase में we have taxanes, Vinca alkaloids again. Cell cycle non-specific drugs में we have alkylating agents such as your cyclophosphamide, metotane, your cisplatin, your meclorethanamine. Anti-cancer agents, anti-cancer antibiotics में we have doxorubicin, daunorubicin, cisplatin and procarbazine. So let's understand the important classification of cancer. So this is one of the most important classification, in which first we have is the alkylating agents. Now in alkylating agents we have further 5 classes: nitrogen mustards, in which we have meclorethanamine, cyclophosphamide, efosamide, chlorambucil, melphalan. Ethylene imines में we have thiotepa. Alkyl sulfonates में we have busulfan. Nitrosoureas में we have carmustine and streptozocin. Triazine में we have dacarbazine. Then we have antimetabolites further classified as folate antagonist, purine antagonist and pyrimidine antagonist. Now folate में we have methotrexate alone. Purine antagonist में we have 6-mercaptopurine, thioguanine, azathioprine, pentostatin, fludarabine, cladribine. Then pyrimidine में we have 5-fluorouracil, floxouridine, cytarabine and gemcitabine. Then antibiotics, we have actinomycin D, that is nothing but actinomycin, daunorubicin, doxorubicin, bleomycin, metotamycin and mithramycin. Epipodophylotoxins में we have etoposide and teniposide. Camptothecins में we have topoctane and irinotecan. Then taxanes में we have paclitaxel, doxytaxel. Vinca alkaloids में we have vincristine, vinblastine, vilorabine. Miscellaneous agents में we have metotane, interferon alpha, cisplatin, hormones, and their antagonists में we have glucocorticoids, androgens, anti-androgens, estrogens, anti-estrogens, progestin and aromatase inhibitors. Let's understand what is first the nitrogen mustard, specifically the alkylating agents. Now this is the mechanism of alkylating agents, where they form a highly reactive carbonium ion, transfer alkyl groups or substituted alkyl groups to the cellular macromolecules by forming covalent bonds, which results in the intrastrand cross-linking, abnormal base pairing, breakage of DNA strand or inhibition, and this leads to inhibition of DNA synthesis and cell death. Now I'll explain you diagrammatically here. So this is my DNA strand. Okay, we have the bases, 4 bases, purine bases, 2 purine bases, 2 pyrimidine bases. Yes, adenine, guanine, thymine, cytosine, and in case of RNA it is uracil. So these are the 4 your bases, 2 pyrimidine and 2 purine bases. Now what happens, any of the alkylating agents comes, and if it is forming a covalent bond here, okay, so it is causing an intercalation. Yes, there is an intercalation, due to which there is the if here it occurs, so there will be no formation of further DNA strands. As we all know, this DNA strand here further replicates to form the other. Yes, so if यहाँ पर ही I am stopping it, will the further replication or growth occur? No. So this is one of the conditions of the alkylating agents, and other is it causes the interstrand interstrand cross linking होता है, और it is intrastrand intrastrand cross-linking or interstrand cross-linking, or sometimes there is breakage of the DNA strand. So this all conditions leads to the inhibition of DNA synthesis. So as there will be no production of DNA synthesis, there will be the cell death, and obviously the cancer will be treated. Okay, these alkylating agents exert the cytotoxic and immunosuppressant or radiomimetic effect similar to radiotherapy. Okay, there are severe side effects of these alkylating agents, but are given to stop the cell division at the earliest. So as we all know, these are highly reactive derivatives which form the carbonium ion and transfer alkyl groups to various cellular constituents, causing the binding with the covalent bonds. And due to these, as there is not metabolic reactions occurring normally, so alkylation of the DNA occurs, leading to the inhibition of DNA synthesis and thereby death. Then we have antimetabolites. Antimetabolites may we have folate antagonist. One thing to remember about the alkylating agents में जो cyclophosphamide है जिसमें acrolein होता है. If you have seen my video for anti-cancer agents or anti-neoplastic agents of medicinal chemistry, you can understand better here that cyclophosphamide causes acrolein toxicity. Okay, and that acrolein toxicity is there is an acrolein toxicity which causes severe neuropathic neuropathic damages, as well neuropathic damages होता है as well as there is a damage to the entire nervous system, and also it causes a severe nephrotoxicity, ototoxicity. These two are very severe toxicities. Okay, and also myeloid sheath suppression, that is myeloma. These all are the important toxicities, or very severe toxicities that occur due to the conditions of these alkylating agents. Now methotrexate is a folic acid antagonist. Now it binds to the dihydrofolate reductase and prevents the formation of tetrahydrofolate. This tetrahydrofolate is a coenzyme which is essential in several reactions. Okay, several reactions which is important for protein synthesis, and thus the rapidly multiplying cells are affected as the inhibition of protein synthesis occurs. So antimetabolites are nothing but the protein synthesis inhibitors. So as there is no supplication of of protein, so thereby it will lead to the deficiency and cells are affected. This methotrexate mainly affects the bone marrow, skin and gastrointestinal mucosa and other rapidly dividing cells. It also has immunosuppressant and anti-inflammatory properties. Okay, so this is nothing but the mechanism for purine antagonist. It enters into the cell, binds with the active metabolite. It is incorporated into the DNA, which breaks the DNA strands or decreases the DNA synthesis, thereby inhibiting the protein synthesis. Pyrimidine antagonist क्या करता है? Pyrimidine antagonist, which resembles to the active metabolite जो होते हैं, that resemble to the natural nucleotides, and they compete with that natural nucleotides and are incorporated into the DNA in place of natural nucleotides and inhibit the DNA synthesis. 5-fluorouracil is a pyrimidine analog which inhibits the enzyme thymidate synthase, and due to which the synthesis of thymine is inhibited, and thereby DNA synthesis is used in the carcinoma of stomach, colon, rectum, breast and ovaries. Let's move to the important antibiotics. Antibiotics are very pronely given, or you can say it is used maximum in the cancer patients. Okay, generally the first line drugs or the first step is to prescribe antibiotics, that is killing action of the biotics or the killing action of the bacteria, okay, that causes cancer. But in severe cases, what happens due to the antibiotics, there is certain resistance which is created, and hence the other drugs are to be prescribed. So actinomycin or dactinomycin acts by inhibiting the DNA dependent RNA synthesis. This is very important, asked in MCQ. Okay, that antibiotics, specifically dactinomycin, acts by inhibiting the DNA dependent RNA synthesis, and other anthracyclines, that is doxorubicin, act by inhibiting just the DNA synthesis. Okay, and the actinomycin or the dactinomycin is most potent anti-cancer agent, and the rest, epirubicin, metoxantrone, are analogues of these doxorubicin. Metomycin C is converted to an alkylating agent and is used in the cancers of stomach, lungs and cervix. Bleomycin binds to the iron and forms free radicals and causes the DNA breakage strand. Then we have epipodophylotoxins. Etoposide and teniposide are plant extracts. They bind to topoisomerase 2 as well as DNA, resulting in DNA strand breakage. They are used in testicular as well as lung cancers. Then we have camptothecins. These are the first anti-cancer agents. Again, a very important point to remember. These are the first anti-cancer agents. Okay, and this was found to be toxic. Its analog is topoctane, is less toxic and useful. It inhibits the topoisomerase 1, resulting in DNA strand breakages, leading to cell death. They act on S phase of the cell cycle, and both are given through the IV, that is intravenously. Then we have taxanes. Taxanes में paclitaxel was obtained from plant. It binds to the beta tubulin of the microtubules and arrests the mitosis stage. Okay, that is generally the M phase of the cell cycle. Docetaxel is more potent, which is orally effective. Taxanes are useful in breast cancers and ovarian cancers. Okay, they are also found to be effective in head, neck and esophagus and lung cancers. Vinca alkaloids are very important and the most potent, again obtained from the Vinca rosea, Catharanthus roseus species, which bind to the microtubules in the mitotic apparatus and arrest the division in the metaphase. Miscellaneous agents may we have procarbazine, which is effective orally, which damages the DNA. So it damages the DNA of the cell, of the tumor cell. So they are given, but it may make it carcinogenic, obviously. Okay, cisplatin gets converted to its active form. This is an organoplatinum compound, so it converts into its active form in the cell and inhibits the DNA synthesis, and this causes cytotoxicity. Carboplatin is a less toxic derivative of cisplatin and is better tolerated than cisplatin, as adverse effects are milder. Oxaliplatin is effective in advanced colorectal cancer and in other cancers like cervical and ovarian cancers. The last slide, that is hormones are also used in the cancer chemotherapy agents. Now these cancer how it is used. So generally there is a hormone therapy which is used to treat these cancers, as we have seen estrogen, anti-estrogen, progesterone, anti-progestin, anti-estrogens, and your glucocorticoids are used. So what happens, hormone therapy is used. So these hormones are used to grow, and some such as prostate or breast cancers. Okay, specifically, hormone therapy is a cancer treatment that slows or stops the growth of cancers and that uses hormones to grow. Glucocorticoids are generally used in acute leukemas and lymphomas. Estrogens are used in advanced cases